people living with visual impairments and those who are partially sighted should live in a world that is accessible, safe and easy to navigate. This is according to the Limpopo Health MEC, Dieketseng Mashego. Mashego handed over 65 white canes in Polokwane as part of White Cane Awareness Month. The department's initiative seeks to promote awareness about the challenges faced by people living with visual impairment. Limpopo Health MEC, Dieketseng Mashego, joins us now for more. MEC, good evening. Thank you so much for your time. Really do appreciate it. It is also quite often found by a number of reputable studies that many people who live with visual impairment are living with what are preventable visual impairment conditions and or causes, such as, for instance, cataract surgery might be able to solve the visual impairment of a lot of people living with that. Of the 65 people you handed over white canes to today, how many of them are living with preventable visual impairment?
Good evening to you and to the viewers, and thank you for having me as well. Let's start by saying yes, today we had an event where we were promoting awareness during this eyesight month. Indeed, we were giving canes to our people who are living with visual impairments, and out of the 65 that we had handed over the canes, none of them had a preventable causes of the visual impairment. Most of those that were given today are those who are living with the condition that cannot be medically addressed. Hence, we saw the need that we should give them assistive devices so that they can be able to do their daily routines without any much challenge.
Will the department be assisting those 9 individuals who have preventable visual impairment?
Yes, we have already started as the department. We launched the Operation Cataract Must Fall in July. It was Nelson Mandela month, where we dedicated that month to say we'll be assisting our people in the province, especially those with cataract. We said cataract must fall. And since July, we had started during the Nelson Mandela month, we had managed to do 197 people, and then we continued. We did not stop. August, we had our Rural Health Matters anniversary, where we also had operations that were done. And then since we've been having operations being happening all over our province, in all our districts. So far, the total number that we are at since we launched the program in July, it's 729, and we are continuing to say every month there should be operations that are happening, because you are correct to say most of people who are affected by this condition of visual impairment, you'd find that this is caused by cataract, and cataract can be cured, and people can be able to prevent going blind.
And white canes are an important assistive device for people who live with visual impairments. How inaccessible are typically white canes across the Limpopo province?
I would say yes, indeed, they are very much important. And as the department, we had challenge that we did not have, or we didn't issue out these assistive devices, because what would do is would assist patients who have challenges with their eyesight, but once they turn blind, then we'll transfer them or refer them to the National Council for the Blind. But this year, as we've started now to say, as the Department of Health, we should also be starting to say we not only refer, but we have a partnership with the Council for the Blind as the department also procure those assistive devices, because now we've seen that we cannot just deal with those that we are able to operate and they are able to see again. Even if now you've got a challenge that you cannot be able to see, then we can still keep you in the department. As the department, we can still be able to offer those assistive devices. The 300 devices that we have procured are the first, but will continue with the procurement as per the needs of our communities.
So the department has procured 300 white canes?
We have procured 65 white canes, and we've also procured other devices that are helping the people with visual impairments, not necessarily white canes.
What did the procurement of the 65 white canes cost the department, just to get a sense of the scale of the project?
Unfortunately, I do not have the correct numbers here with me.
Do you have an estimate, maybe?
Ensure that I cannot estimate because I do not want to mislead the public, but will ensure that we make those invoices or the clear amount available so that the public can know. But what we can say is that there was value for money, and we'll continue to procure them so that we assist our communities.
Just very lastly, very quickly, if there's someone listening right now, watching right now, who lives with visual impairment and they desperately need a white cane in the Limpopo province, could they come to your office for assistance?
Yes, they can come to my office, or they can use our health facilities, our clinics, our hospitals. We are in good communications. If they go to any of our facilities, then they will be referred to a proper facility where they will be assisted.
Thank you very much for your time. I really do appreciate it. That's the Limpopo Health MEC, Dieketseng Mashego, joining us there to talk about this initiative.